The reason why I became an oncologist is because during my medical training, I came into contact and interacted with a lot of patients with cancer. It's a condition that I really felt passionate about treating and helping to improve outcomes. And in my years of doing this, I'm confident that we have seen improvement in cancer care and that one day we'll eventually have a cure for cancer. Here at MedStar Health, we treat patients with all types of cancers. But the most common cancers that we treat are probably breast cancer, lung cancer, and colorectal cancer, as those are the most common cancer diagnoses in the United States. We do also see lymphomas, kidney cancer, bladder cancer, melanomas, and many other types of diseases. When it comes to determining the plan of care for a patient, it's important to sit down with the patient to review the results of the pathology, of the imaging, in order to know exactly what type of cancer and what stage you're dealing with. This is also followed by reviewing the literature and looking at the national guidelines and the latest evidence in order to know what exactly is the best treatment for that patient. When most people think of cancer therapy, they initially think of chemotherapy. And chemotherapy is very effective for many cancers, many different patients, but we also have other treatments available. And the most significant advancement in cancer care over the last 10 years is the development of immunotherapy. What that is a treatment that uses the body's own immune system to attack the cancer. And this type of therapy is typically more effective and less toxic than traditional chemotherapy. The newer cancer treatments, such as immunotherapy, have definitely led to improved outcomes. Patients are living longer, and some patients are being cured with their advanced diseases because of immunotherapy. When I see a new patient in my oncology clinic, I talk to the patient about tumor profiling, which is a genetic test where we send off the tissue for DNA sequencing to look for specific mutations that may have an impact on their treatment options. We use this information from the tissue profiling to know which is the best treatment option for the patient. Also, the mutations that we find may predict which treatment options are not the best for that particular patient. Multidisciplinary care in oncology is extremely important because typically many different physicians are involved in a patient's care, from the pathologist reviewing the slides to the surgeon doing the surgery, and also patients typically may need chemotherapy and radiation therapy. So multidisciplinary care is when we all come together to review a particular patient's case in order to determine what is the best treatment option for that particular patient. Beyond the actual cancer treatment plan, there is additional support that we can offer patients. There's a team of social workers, case managers, and even dietitian, nutritionists, and physical therapists who can help with the other aspects of a patient's care. What I love most about my job is that every day I'm meeting new people, and the patients that I meet will eventually become long-term friends and feel like family.